So for anyone who's ever known a patient with chronic fatigue, one of the most amazing things about chronic fatigue is that you can look at an individual and you can tell, wow, this person is in some serious trouble. But you run every test and they all come back normal. Not all, but if you run just your basic routine testing, they'll all be normal. Part of this I covered in the talk that I gave, that I did on functional testing, whereby when you reach someone who's had chronic fatigue for any period of time, they know all the ways to try to make sure they don't exacerbate their own problems. And so they will come to you in a situation where they have stayed away from all the stressors that bring out their deficits. And so basically in that situation, you are not going to have any abnormalities because you're really not pushing the cells metabolically to the point where they would show abnormalities. And if you do, then unfortunately the individual pays for it for the next few days in trying to recover from that exertion. If you look at the culprits for causing chronic fatigue, many of them are going to be dormant viruses and atypical bacteria and fungi. And the tricks that these folks have learned over the millennia is that they shouldn't come out when you're doing well. They should not be active when encountering an intact and strong immune system. They need to sit tight and wait until such time when there's an opportunity for growth. And then at that time, they come out and they divide. They go from being, infecting 5% of your cells to, say, infecting another 2-3%, and then if this cycle happens enough times, then you have a system that is significantly compromised with those viruses or fungi or atypical bacteria. But in general, our body is made not to really deal with these long-term issues because we didn't used to live this long. We used to have to only deal with the acute life or death situations, and we're not accustomed to these in-between kind of dormant viruses that once in a while become active. And so that's a big part of why a lot of these tests are going to be normal, is because the virus is sleeping at the moment and the individual has learned not to do the things that cause the metabolic disturbance that make them feel bad, that may show some abnormalities on routine tests. But just because routine tests are not positive, and just because we have not perfected functional testing for chronic fatigue, that does not mean that chronic fatigue is not associated with abnormalities. I can show you loads of abnormalities in my patients who have chronic fatigue, and they are treatable.